Hi, my name is Kelly Stenwall, and I am a United States University student. I am recording this video for class nursing 553. I'm going to unplug my camera for just one moment so I can scan, because part of the class is I have to scan and show I do not have any extra things sitting around, no papers, blah, 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 blah. I'm putting that in. I guess I should put that. I don't know. Show. Okay, that's the room. Scan the room. Here's the table and the chairs, and there we are. Okay, I'm gonna plug my computer back in. Michael is here. Hello, Michael. You can come out, Mike. Okay, I am have a seat. Thank you for letting me interview in your home. I am a United States University student, and I am recording this video for class for YouTube to view for students and instructor. And I just need your consent with your name and birthday and consent to video and post to YouTube. Or do I have your consent?
Yes, my name is Michael Hofer, birth date 11/24/1964, and you do have my consent to record and post this video.
All right. So it is for class nursing number 553, advanced health week number 1 interview, physical ROS. So what brings you in here today? Remember, we're like having to act like this is a real doctor's office.
Yes, I understand.
Okay.
I moved to the area a year and a half ago, and it's been a year since my annual physical. I need to establish care down in this area.
Okay. And do you have any prior medical history?
Just asthma and allergies primarily.
Okay. Any other things such as sleep apnea or anything like that with
Oh,
your...
yes, I snore like a bear. So,
Okay. Okay, good. And then, so when did your asthma start?
I would say probably about 11. No, it'd be 10 years of age, fourth grade.
Okay. And do you have any other surgical history? Any surgeries that you've ever had or anything like that?
Just stitches from being stupid a few times.
Okay. And where would those be?
My thumbs, my arm.
Okay. And then when was your last physical?
It would have been March of 2022.
Okay. Do you feel like you're in overall good health?
Yes.
Okay. And what do you do for a living?
I am a millwright, which is an industrial maintenance technician. I work on heavy duty machinery.
Okay. Dog.
Yes, my dog is being needy.
Can you tell me your other prior medical history? So you told me asthma, sleep apnea, any childhood illnesses?
I have allergies to dust, mold, cats, ragweed.
Okay.
And back when I was taking less better care of myself, I was pre-diabetic and had a little bit of high blood pressure, but that is now gone.
Okay. And what about those? How made them go away?
Diet, exercise, and healthier choices.
Okay. How about any vaccinations or immunizations? Did you get your childhood ones?
Yes, I had all my childhood vaccinations. I have had COVID and the 2 COVID shots and 2 boosters. I've had tetanus. I've had shingles. As far as I know, everything I'm supposed to have for someone my age.
Okay. And how old are you?
58.
Okay. And do you use safety equipment at your job?
Yes. Hearing protection, safety glasses, hard hat, steel toes, gloves.
Okay. And what medications do you take?
I take Advair for my asthma twice daily. I have a Buterol inhaler for rescue, which I use maybe max once or twice a day, but rarely now that I'm on the Advair. I take Zyrtec D and Benadryl.
Okay. Why do you take the Benadryl?
On my allergies.
Okay. And you said you were allergic to dust, cats, and mold.
And ragweed.
And ragweed. Okay. And do you have any other problems getting your medications prescribed for you or picking them up financially?
No.
Okay. Do you have for your, I'm going to ask you a whole series of questions, and it's just so that I can get to know you better, okay?
Okay.
So for your, do you know what year it is?
It's 2023.
Okay. Do you know who's president?
Mr. Biden.
Okay. And have you had any changes of your mental status or dizziness or vision changes recently?
No.
Okay. Have you had any hearing loss or any difficulties with your ears or any problems with that?
No.
Okay. Let me see what else. I have to stop and think for a second. Cardiovascular problems. Do you have any heart problems or anything other than the hypertension that you've now corrected with diet and exercise?
No. My blood pressure's right down the middle of the road. No.
Okay. And besides your asthma and you said some sleep apnea, anything else that you have going on with your respiratory status?
No.
Okay. Any GI problems at all? Any nausea, any GERD, any constipation or diarrhea?
I mean, if I ate too late, eat something spicy, I'll get a little heartburn at bedtime, but that's about it. I could
Mhm.
easily treat it with over-the-counter medication.
Okay. Do you have any difficulties urinating or having any problems like with kidney stones or bladder issues at all or incontinence, any of those things?
No, I do not.
Okay. Musculoskeletal. So do you have, I mean, you told me your thumbs. Do you have full range of motion
Oh,
with your
yes.
thumbs? Okay. And what happened to your arm that you had to have stitches?
Had
Was
a
it
dog
broken?
bite.
Oh, a
Got a
dog bite.
dog. A dog bit me at work.
That does not sound fun at all. Was it at your current job or a previous
No,
job?
previous employer. I used to be a meter reader.
Okay. That sounds interesting. That was a lot of walking around.
Yes.
Good. Okay, so for integumentary, do you have any rashes or open areas or moles that you might need to have looked at or anything like that?
The only two moles I had that were questionable were removed
Okay.
several years ago.
Okay. And were those positive for anything or
No,
were they okay?
they were all negative.
Um, and neurologically, do you have any headaches, frequent headaches, or numbness or tingling to your hands or feet?
No,
Okay. Um, have you ever had tingling to your hands or feet or anything?
only when I work. Like if I've got a hard job at work and I wear my arms out wrenching or hammering, then
Okay. That sounds like you have a hard physical job.
yeah,
Okay.
you swing a 2 or 4 pound sledgehammer on a piece of metal to get it to move for a half a day. It hurts a little bit.
I don't think I could do that job. Psychiatric disorders. Have you ever had any psychiatric disorders or addictions or any difficulties with that?
I was treated for depression prior to my divorce
Okay.
and saw a psychiatrist for 2.5 years.
Okay.
Took Wellbutrin during that time, but that would have been 2005.
Okay.
And
So that was quite a while ago.
I was given a
Okay.
clean bill of mental health and
Okay.
discharged.
Okay. So for your endocrine system, we would, when we get to a point where we have to do a physical and stuff, I would check out your thyroid. Have you ever had any thyroid problems or diabetes issues? Um, any kidney issues?
Before I lost the weight, my A1C was getting to the area where it was a concern,
Mm-hmm.
but I met with the diet and nutrition
Okay.
specialist and
Do
made
you,
corrections, and
okay. Do you remember what your hemoglobin A1C
I
was?
do not.
Okay. And how much weight did you lose?
About 35 pounds.
Perfect, good. And then any blood disorders that you've ever been told of, like sickle cell disease or lymphoma or bleeding disorders, clotting disorders?
No,
Okay,
nothing.
okay. And then immunology, have you ever had any like vaccination problems or anything like that that you've had when you've gotten a vaccination, anything like that?
Um, Other than a sore arm, nothing.
Okay. So now we need to talk about your family history a little bit. So you told me your history. So does your mother have any diseases or anything that you might know of?
She has severe hearing loss.
Okay. Is it age related or due to something else?
I think it's probably something else. She ended up having to have a cochlear implant.
Okay. So more like a genetic problem.
Hmm.
Okay. And then is she still living?
Yes,
And how old is she?
she is. Let's see, 84 years old.
Perfect. Okay. And your father, is he alive?
Yes.
And how old is he?
83.
And does he have any health issues?
My mom and my dad both have asthma and arthritis, and my dad has hearing loss as well, but not his is corrected with a hearing aid.
Okay. And then, okay, so we're gonna go through your mother's parents and then your father's parents. So did your
And
grandmother have any problems with on your grandmother's side?
she lived to be 99 and had a stroke, a small stroke, about 5 years before she passed, and couldn't speak after that, but
Okay.
she would still get around with a walker and
Okay.
was as feisty as ever.
Okay. And were you around her at that time period?
I was down in Whiting at the time, so I mean I saw her like once a year, not
Okay. How about your mother's father?
um alcoholic until he was in his 70s, lived to
Okay.
be 85,
Okay.
and the only thing he ever had was bad knees. He got his
Okay.
knees replaced when he was 82 and went back to work.
Okay. And then how about your father's parents?
My grandmother passed when she was probably in her mid 70s of acute emphysema, and my grandfather on my dad's side had hearing loss, arthritis, lived till he was 87,
Okay.
and got cancer in his neck with 6 months before he passed.
And do you know what kind of cancer that
I
was?
do not.
Okay. Um, so do you have any siblings?
Yes,
How many?
3 sisters.
Okay. And how old are they?
They are 65, 59, and 57.
And are they alive?
Yes.
Okay. Do they have any disease issues? How about that? Let's start with the oldest one first.
She has asthma,
Okay. Any
and
other, is she have
just
any obesity or
yeah,
diabetes or
she
anything?
struggles with her weight like we all do.
Okay. How about the next sister?
She's just crazy.
Well, okay.
Sorry.
Okay. What do you mean she's
I
crazy? I mean, is
she
she diagnosed with something? Does
she
she have a
should be,
mental
but
health?
she won't go. She's bipolar and self-medicates with.
Okay, but she's never been diagnosed with the
No.
bipolar. Okay. And the third sister?
She has addiction issues and some mild asthma, but
Okay, and what is she addicted to?
unfortunately, meth.
Oh, that's unfortunate. You have a
Yes.
lot of addiction, it sounds like, in your family. So do
Yeah.
you struggle with addiction as well?
If I used to give into it, I have decided to start making better choices, and so now I limit myself to one or two instead of 12 or 14.
Well, that's better decision.
Yes.
So if you didn't have that one or two, what do you think would happen?
It's if I do it now, it's just to relax and unwind at the end of the
Okay.
day. It's not
Okay.
to run away from my problems like I used to.
Okay. Well, that's awesome. And then so we also have to discuss a couple other things. So, what kind of diet do you have?
I would say it's normal. I've since my weight loss, I try to add more fruits and vegetables and
Okay, great.
smaller cuts of lean meat. I'm much more conscious of portion size now than
Okay,
I used to be.
okay. Do you exercise?
I need to get back to it. I was very faithful and I have not for the last probably 8 months, but I was doing it 3 times a week. And
No, you're not.
yeah,
Okay.
so I
And
need to
so
get
do
back to it.
you, you said you drink alcohol. Do you use caffeine or any other drugs like smoking or anything like that?
A cup of coffee in the morning and a Diet Coke in the afternoon. That's my
Okay.
caffeine, and I quit smoking 26 years ago, or
Awesome.
25 years ago.
That's awesome.
Yep.
That's great. How much did you smoke?
Half a pack a day, maybe.
Okay.
Pack would last me 2 or 3 days.
Okay. And when did you start drinking alcohol?
When I was 13.
13. Oh,
Yes.
oh, wow. That's not even legal age, even
Mm.
anywhere close to that.
Yeah, South
Okay.
Dakota, it was close enough.
Okay. So, some of the other things I need to ask you are a little bit more personal. So, you identify as a male?
Yes.
Okay. Are you
Heterosexual male.
heterosexual male? What was your sex on your birth certificate?
Male.
Okay. And then what is your living situation?
I live with a significant other.
Okay. And are you spiritual? Do you have a social support system at where you are?
Yeah, I would say I'm spiritual, but not religious. And
Okay.
I have a very close knit group of like minded friends who are very
Okay.
supportive.
Okay, that's awesome. And then are you sexually active?
Not near as much as I'd like to be, but yes.
Okay. Okay. And then so we have to ask some questions that are very personal. And so some of those are things like how many sexual partners have you had, if you could just guess? I mean, you could say since whichever. You don't have to tell me an exact number if you don't want to.
I honestly don't know.
This look on your face
I
is
am.
like, I don't know.
I was in a rock band in the '80s. I honestly don't know,
Oh,
but
well,
I used protection. I was faithful about that.
okay. So you ever been had a history of any sexually transmitted diseases?
No, I got tested for everything after my divorce to make
Okay.
sure because my ex-wife was busy.
Okay. And how many children do you have?
I have three.
Three children. Okay. And then, so you say you live with your significant other, good support system. Do you have a history of any violence in your life, like against you, like emotional, spiritual, or physical violence to you?
My father was very verbally and emotionally abusive, as was my ex-wife. So
Okay.
hence the depression and the 2.5 years of therapy.
Okay, well, I'm glad to see that it's helped you out. That's
Yes, it
awesome.
has.
Good. How about, so one of the things they ask about is your ADLs. Do you have any difficulties getting a shower, dressing yourself, cooking for yourself, or buying your groceries?
Oh no.
Okay. And do you have any financial concerns about being able to attain food, housing, or medications?
No.
Okay. Do you have any other questions for me today?
Nothing I can think of.
Okay, we've went over a lot of things. If there's anything else, and so then what we would like you to do in the future is we need to set you up for a colonoscopy. I don't see
I'm
any of
saving
that.
that for my 60th birthday.
Okay, because I don't see that in your chart anywhere for
No,
your
but
colonoscopy.
I mean, I've been putting it off because I have zero family history of any
Mm-hmm.
problems in that area.
Okay.
And I've never had a gastrointestinal problem in my life, but I did agree with my last provider that when I'm 60, I will get one.
Okay. And we'll probably draw some labs just to check like your PSA, which is your prostate
Mhm.
problems and stuff. Uh, Later set you up for an exam for that. And especially because your father had some blood issues or whatever, and prostate issues, we would want to check those. Maybe keep an eye on your asthma, and we can go forward with that, and a pneumonia vaccination.
Yeah, I don't think I've had that. I would have to check.
Okay.
Say about the only other concern I'd have is probably start going down avenues to see if there's
Okay.
a surgical solution to my sleep apnea because I
Okay.
tried a CPAP and it does not work.
When did you have a CPAP?
It would have probably been over 20 years ago.
Okay, and it didn't work for you, and you're
No,
snoring.
I'm a side sleeper and a light sleeper, and every
So,
time the mask would leak, it would whistle in my ear and
okay.
wake me up.
So a sleep study might even be
Yeah, it's been a
something
long
one.
time since I've had one done, but I mean, I was literally there for 2 hours and they woke me up and sent me home. Said,
Oh,
"Yeah,
okay.
you
You
need a
got snore.
CPAP."
Okay. So a sleep study might be good. But you said you were doing something else for that. Did you say you were saving up for that?
Yeah, I've been saving to get nasal surgery in case I need it. So
Okay,
I'm
perfect. Okay.
getting to the point where I'd like to start looking at those options and see if it's
Okay,
viable.
good. So we can go forward with that. Okay, so again, this is Kelly Stonewall, a United States University student, class nursing 553, and we will be posting. Thank you.